So we're going to talk about why you're still suffering. We're going to talk about hidden ligament injuries that are often missed, leading to chronic pain and disability. I am part of a Smart Injury Doctor program, okay? So not only am I certified in chiropractic biophysics, which is the #1 structural rehab certification program in the world, also I'm part of a group of doctors that specialize in traumatic spinal ligament injuries. So they're experts in diagnosing, treating, and managing. So Smart Injury Doctor. So if you have a question on this video, finding a doctor near you that understands the nature of traumatic ligament injuries, look up Smart Injury Doctors in your area. Very simple. We're throughout the United States, and we deal with ligament injuries, traumatic, disc, and non-disc. Okay. So very simple. When you have a trauma, whether it's a sports or work or an automobile crash, really only 3 things can happen to the spine. We're not talking about a closed head injury. We're not talking about a brain injury. We're not talking about a lacerated kidney. We're talking about spinal problems, okay? There's really only 3 things that can happen, all right? Either you have a fracture, you have a disc problem, you have a ligament or support ligament problem, or you have a little of both, okay? Now look at this picture here. This is what happens when vertebrae move too much, slide back and forth. And this picture here is angulation. It's when vertebrae bend too much. Now, real simple, we're talking about the bone and ligaments. So we're talking about these red ligaments. The red ligaments are the support ligaments. This blue is the disc. The disc is the shock absorber between 2 bones. Now, very simple. What happens when you have an injury? Well, most of the time, you are injuring these ligaments here. See how this vertebrae shifted back? That is a sprain, just like a sprained ankle or a sprained knee. It's a partial tearing of the ligament. And when that happens, ligaments hold you in alignment. You get excessive motion. Now, some of you might be old enough to know certain quarterbacks like Joe Namath, where they keep injuring their knee to eventually the knee is so sloppy you can't stand. Well, that can happen to your spine. So excessive motion leads to something called an instability. So the most common cause of pain and suffering is this ligament damage, all right? And very simple, how do we know that? That's from a stress x-ray, all right? That's an x-ray while you bend and move, and we'll talk about that a little bit later. The next thing that can happen, maybe 25 to 33%, is a disc herniation. How do we diagnose that? That's an MRI. All right, we've talked about that a little bit in my previous videos on L4, L5 disc problems. And then you can have a fracture, okay, and that's a little bit less rare. Or you can have all the above. So very simple, only 3 things happen: fracture, disc injury, or a support ligament injury, or all the above, okay? So how do you find out if you have a fracture? X-ray and CAT scan. So this is how we find, this is what should be done anytime you have a serious trauma. And it doesn't matter if it's work, sports, or a car accident. So let's talk about, very simple, the red ligament. These are support ligaments. And the blue is the disc. And what do you see here more? Do you see more red or more blue? You see more red because there are more ligaments, far more spinal support ligaments to damage than there are discs. You can have severe damage to the support ligaments without a disc. So this is what we're looking at. Now this is a picture of the upper neck. We're talking the upper 2 vertebrae in the neck. And interesting enough, there is no disc between your skull and the first vertebrae. So when you have an MRI of the neck, it starts at C1, it starts at C2, C3. So from C1 to C2, there's not a disc. So I want to be very clear. C1 to C2, no disc. So the MRI often misses that. So there are hundreds of micro ligaments, and 2 things can happen when you injure those ligaments. Either you have excessive shifting of the vertebrae forward and back. That's called translation. Or you have too much angulation. All right, remember, ligaments hold you in alignment. And when you injure them, you lose your alignment. And what happens is you have excessive motion, and there's degrees of it. There's mild, there's moderate, and there's severe. This is the disc that absorbs shock, and very commonly we diagnose that with an MRI. So, 3 types of injury. Each of these injuries have different symptoms. And very simple, the support ligament injury is the far worst. This is a fracture, this picture. This is excessive motion injuring the support ligaments, and this would be a disc injury. Or you can have all the above. You're allowed to have more than one problem. And so really, what are the symptoms of a disc? Well, typically, it's generally two. If you went to, very simply, looked up what are the symptoms of a disc under Medscape, it's going to be axial pain, which is right along the center of the spine. Or you're going to have radicular pain going down your arms or legs. That's the most common symptoms you'll have, either axial pain or radicular pain.